professionals, health professionals, to do the work of healing. In fact, she wrote a book in 1891 entitled The Medical Missionary. And primarily, she was referring to physicians, to nurses, to health professionals. And I just want to quote for you here some of the things she says in that book, part 15 in January 1st of the book in 1891. She said, there should be those who are preparing themselves to become Christian missionary physicians and nurses. And doors will then be open into the family of the higher classes as well as among the lowly. So she was talking about, again, the medical missionary being physicians and nurses, inviting people to come and to be trained in our institutions. As you might remember, around this time, the Western Mission Institute was being formed there, which became the sanitarium in Battle Creek. And the focus was to train nurses and physicians in this work. In fact, again, in this book, in the book Medical Ministry, she talked about how we should educate pleasantly, intelligently, as one of the ways in engaging in this work, preaching the truth, praying the truth, living the truth, bringing it with its gracious health-giving influences within the reach of those who know it not. And as the sick would be brought into touch with the life-giver, with Christ, their faculties of mind and body would be renewed. So she combined, and she talked about the importance of this work, combining the preparation, but also leading people to Christ in a pleasant way, in an intelligent way, as well as educating about lifestyle choices. She, again, in the book of Medical Missionary, she talked about, she was deeply interested in the subject of medical missionary work and the education of men and women for that work. So again, she's talking about the importance of educating, training people in this. And I could wish that there were 100 nurses in training where there is one. In other words, again, the call for people to become health professionals, in this case, she's talking about nurses. It ought to be thus both men and women can be so much more useful as medical missionaries than as missionaries without the medical education. So once again, a focus on educating health professionals. In medical missionary work, much of that first usage of the term was related to those doing work in the medical field and as health professionals. In almost every church, she wrote, there are young men and women who might receive education either as nurses or physicians. Again, the focus being health professionals. Now, as time went on, and we started doing a lot of training in preparation of these medical missionaries as physicians, nurses primarily, and then obviously with time, other professionals, it came also clear wisdom and counsel in terms of the role of everyone in this area. And in fact, she wrote that, I wish we were all health reformers in the same book. So started to talk about the role of everyone living the principles and then being agents of health. And in the book she wrote later on in 1905, Ministry of Healing, which she puts together all the counsel on this, then more emphasis was done in the role of everyone being part of this mission, this medical missionary work. And besides those that are trained, then we need everybody becoming involved. In fact, she wrote here in manuscript 105, even before she wrote Ministry of Healing, God calls not only for your benevolence, but for your cheerful countenance. Yeah, not so much, all the different procedures and things, but talking about smile, your cheerful countenance, having a happy face, hopeful words, good attitude, grasping people by hand. In other words, that compassion, that touch of those that are hurting. There are souls who have lost their courage. Speak to them, pray for them, bring them to Jesus. This is the kind of medical missionary work to be done. And so again, the emphasis here is not the treatments, is not the procedures. Many of procedures and treatments which the nurses, the doctors were trained to do. She's talking about now an attitude as well. And as you incorporate the knowledge about healthful living, which has to do with the laws of health or with the principles of health that we know of, that she talked about, this is more than just those clinical procedures, but also teaching, educating people how to live healthfully and having an attitude of empathy, compassion, love, touching people, sharing words of hope and leading them to Jesus, praying for them, as she says here. And so medical missionary work became expanded to include all these things, and not just for health professionals, although that is still directly a priority in this ministry. People trained professionally to do this. As she said, we would be more effective if we had that kind of training. But we also then, with the Ministry of Healing book coming out, inviting everyone to be part of this mission and following Jesus' method, which we mentioned several times these last few days, being the only method that would bring true success in reaching the people, which is basically mingling, relating to them with empathy, love, as one who desired their good, as Jesus did, showing this sympathy, this compassion, and then ministering to the needs. Now, obviously, here too, all needs, physical, mental, emotional, social, relational, spiritual needs, and then inviting them, those that are open, to come and follow. So that became very center to what medical missionary work is about. Now, in the minds of many, the term still, because she talks about training and the importance of that, and the role of the natural laws of health, the natural remedies, as they're known, the 8 laws of health or 8 natural remedies. All of that brings together this idea that we as Adventists not only believe that we need to do the therapeutics, the treatments, but also teaching people the principles of healthful living so that can prevent disease. Many times these principles can also help in the recovery of disease. And so in the last few years, I think yesterday Dr. Lennon mentioned this, looking at this whole concept of medical missionary work and to avoid confusion with the term medical missionary, because obviously it links to the idea of medical training or medical work as originally it got started being used. We came to this term, comprehensive health ministry, where this is a health ministry focusing a lot, not only in health professionals doing the treatment, the working in hospitals and clinics, etc., because of their training, but also, or even lifestyle centers, but also inviting all the lay people to be part of educating, as she pointed out earlier that I shared with you here, educating pleasantly and intelligently, educating about healthful living. And so comprehensive health ministry is the term we're using now, rather than medical missionary work, to rebrand what was medical missionary work to be more inclusive of other people. Now, to this day, obviously, there are many groups that go out doing medical missionary training, which in fact, it's training that it's to train people how to teach healthful living, not necessarily to do medical procedures or interventions in place to replace health professionals. And so we like the term comprehensive health ministry because it talks more about what it is. And as Dr. Linda's mentioned yesterday, it's about meeting people's needs in various ways, in ways that are practical, but also showing God's loving compassion as we do it. And it does not limit itself to health professionals, but we ask and include the pastors, the administrators, every ministry of the church, not just health ministry, but family ministry, children's ministry, youth ministry, all the ministries of every age group, and also our universities and schools, besides our hospitals. Now, there is this idea sometimes that people that subscribe themselves as medical missionaries who are not health professionals sometimes may be tempted to take the role of, telling people how to treat their disease or how to use this or that herb or natural remedy, like it was mentioned, from hydrotherapy to many other things. But sometimes, as if this replaces the treatment of people by health professionals, people trained to actually do treatments. And so today we are much more careful in the kinds of things that we engage in health ministries, so that we protect the church and not engage in treatments unless we have the adequate training to do so. And so a lot of the emphasis that we have in comprehensive health ministry is to orient people, educate people so they can educate other people in the community in terms of healthful living, rather than treating people, because treatment in most countries today is protected by law that only people who are professionals can prescribe treatment. And so we have to be very careful in terms of that. And I know that this is part of what it was being said earlier today. Oftentimes in health meetings, we have groups, that subscribe to different ideas, and sometimes it becomes an issue that we need to bring clarity to. Because what is our focus in health ministry, comprehensive health ministry? Yes, we have the hospitals, clinics, people trained as health professionals that are called to do that, and they are obviously medical missionaries if they have the passion in their heart to also bring people to Jesus, because that's part of that. But then we also have lay people who are passionate and called to be part of this ministry, which we call comprehensive health ministry. They're not trained as health professionals. They're trained in healthful living and principles of healthful living that they can educate others on and teach. And even, with coaching skills, we like to say, walk beside people as they incorporate that in their lifestyle. But there's a fine line there, because when it comes to treatment, even though some things like certain hydrotherapy treatments or even charcoal treatments and other kinds of things, they have to have adequate training to be able to do that. And sometimes that can become a liability, depending where it's done and how it's done. If it's not done within, a clinical setting, a lifestyle center with supervision of physicians and other trained health professionals. And so we have to keep those two things in mind as we think about what can we do and should we be doing as a local church. A church that is not a clinic or a hospital. We have to be careful because of the liability, and Dr. Landis mentioned that yesterday, when we start to actually treat people in a church setting, it can really increase the risk for the local church and all the different institutions of the church. So we have to primarily educate, and we talk a lot about health education, health promotion, and prevention as the primary emphasis that we have in the local church. So in this context, I want to talk about some pitfalls that we should avoid as we engage in our ministry in the local church. I'm talking about now comprehensive health ministry done in the community setting, primarily focusing in the church being a center for healing, for comprehensive health ministry. And so again, pitfalls in the term medical missionary work, which we call comprehensive health ministries. I want to suggest 3 pitfalls that we should avoid. First, there is the issue related to the indifference with the message. And then there's the fanaticism, the other extreme, and then the wrong focus that we may have. And the enemy has used the 3 things here to actually derail us from the original goal that God had of bringing this to our message. Let's talk a little bit about indifference. Ellen White had a lot to say about that among leaders, church members who are indifferent about this message. In fact, she says, the subject of health reform has been presented in churches, but the light has not been hardly received. And she says the many times is the selfish, health-destroying indulgences of men and women, I added, have counteracted the influence of the message that's to prepare us for the great day of God. So sometimes people prefer their own desires and likes, selfish indulgences, she called it, which actually it could be all the way from, the way we eat and like to eat to the way that we like to spend our time or the kinds of things we do, like a sedentary lifestyle. So these are things that we may like to do and that we don't want to change, even though we have heard about the health reform and the things that will be better for us. She says there are those, and these are some strong words, she says there are those among us who occupy important positions of trust and who have refused to follow the light. She's talking about the light of this message of health. And their course has been displeasing to God. Let those now turn to the Lord that their example may no longer be a temptation to others because of the example set by some of these influential men in the indulgence of appetite, for instance. The truth has not made the impression on other hearts that it might have done. I appeal to you now to set an example of self-denial. So she's talking here to people of influence in the church, pastors, leaders of the church, so that they don't become indifferent to the message, so that they can become an example in living these principles, because unfortunately their example speaks loud and other people don't follow because they don't follow, they're indifferent. And she goes further to say, if the churches expect strength, they must live the truth which God has given them. If the members of our churches disregard the light on this subject, and she's talking about health reform, they will reap the sure result in what? Can you read with me? Spiritual and physical degeneracy. So we're talking about not just health, physical health, but we're talking about also spiritual, dormancy, if you will. And the influence of these older church members will leaven those newly come to the faith. So again, the problem of indifference. The Lord, and this is very strong, does not now work to bring many souls into the truth because of the church members who have never been converted and those who were once converted but who have backslidden. What influence would these unconsecrated members have on new converts? Would they not make of no effect the God-given message which his people are to bear? And all of these comments she's making in reference to how we embrace the message of health, the health reform. And so it's interesting that she says the strong words that sometimes God is not bringing more people into the church because we are not converted fully into this message, and we would be a bad influence, in other words. So maybe they're still out there and about to come later when, things may change. So when the third, now she continues on, when the third angel's message is received in its fullness, then health reform will be given its place in the councils of the conference, in the work of the church, in the home, at the table, and in all the household arrangements. When this happened, then the right arm will serve and protect the body, which is the full gospel, right? And so indifference is one of those pitfalls. And I don't know if that falls into us because, our tendency is to think of others. Say, oh, yes, so-and-so and so-and-so. How about me? Am I indifferent in some area that God has impressed me to improve and I'm not? And so this message is for us. Now, a second pitfall, very common, and I would say sometimes is even more damaging than the first, is fanaticism. And this, unfortunately, falls a lot on the shoulders, sometimes of well-intended, zealous health reformers, who, on the other hand, are used not by God, but by the enemy to make it more difficult for others to embrace this message. And she goes on to say here, it is the desire and plan of Satan to bring in among us those who will go to great extremes, people of narrow minds who are critical and sharp and very tenacious in holding their own conceptions what the truth means. They will be exacting, they will seek to enforce rigorous duties, and go to great lengths in matters of minor importance. Through the work of a few of these class of people, the whole body of Sabbath keepers will be designated as bigoted, Pharisaical, and fanatical. And the work of truth, because of these workers, will be thought to be unworthy of notice. So she's talking here about fanaticism, extremism, and how many times this is what Satan wants. In fact, he used this all along, even in the Middle Ages, and after that, when we had the Protestant reform happening, the early reformers fell into fanaticism, and that's part of the problem, why, that didn't grow to be more powerful. And so this is still happening today. And now talking specifically to health reformers, when those who advocate health reform carrying the matter to extremes, she says people are not to blame if they become disgusted. Too often our religious faith is thus brought into disrepute. And in many cases, those who witness such exhibitions of inconsistency can never afterward be brought to think that there is anything good in the health reform. Because of what? Because of some who carry matters to extreme. These extremists, she says, do more harm in a few months than they can do in a lifetime. They are engaged in a work which Satan loves to see go on. And I don't know, and I think our team, at least those that are leaders, may agree with me that when we travel around the world, one of the greatest obstacles for comprehensive health ministry, for medical missionary work, is exactly this, where fanaticism, extremism becomes such a problem, and then many people become indifferent because of it. So sometimes the indifference that I mentioned earlier comes as a result of the extremism and the fanaticism of some zealous health reformers that unfortunately are used by the enemy of God to make others disgusted with the message. And they may never want to embrace the message because of these attitudes. Now, she reminds us, we don't make the health reform an iron bedstead, cutting people off, stretching them out to fit it. One person cannot be a standard for everybody else. How many times we see people saying, no, you have to do it this way, you might eat this thing and not do that thing, and it becomes their standard. What we want is a little sprinkling of good common sense, she says. Don't be extremist. If you err, you should be err, or it would be better to err on the side of the people than on the side where you cannot reach them. This is another idea of the fact that we need to come close to people. People are more important than the health reform. And sometimes if you need to err on the side of them so we don't lose them, so we have their relationship. And so this is a big pitfall that we need to be worried and careful about not falling for. And unfortunately, we see this being a major obstacle in many places. Maybe not here in the Southern South Africa Union, right? No? Or you're like other places? So, God wants us to be careful and to have good common sense. Many people, unfortunately, misuse Ellen White to promote things she wrote to specific people as if this was for everyone. And there's some counsels that she has written specifically for people for their situation and not for everyone. And unfortunately, because we have a lot of compilations of her work, sometimes they mix together everything she wrote on health, including what was in some of the letters, counsel for specific people. And certainly we have on books, counsels of health, things there that were specific for certain people and not necessarily for everyone. And people were teaching it as if it's for everyone. And so we could spend a long time talking about some of that. The one book that's not a compilation that beginning to end she wrote is Ministry of Healing. That's why the balance of that book, this should be the book we use as the main book for comprehensive health ministry, for medical missionary work that is inclusive of lay people, because it's talking about everything from beginning to end in a balanced way, And the counsel there is for everyone. And so it's important for us to see. Now, the third one and last thing that I want to mention is the wrong focus of the message. Now, this wrong focus can be many different things. It could be, for instance, making the health message the gospel, where it becomes the most important thing. And so she says in Testimonies, Volume 6, while the health work has its place in the promulgation of the third angel's message, its advocates must not, in any way, strive to make it take the place of the message. Unfortunately, we focus so much on what to do, not to do, this way, that way, instead of focusing in the Christ of the message, in the gospel. And what is the gospel? Is the gospel the health message? No, it's the right arm of the gospel. So the gospel is centered in Christ and what he's done for us. You will never gain heaven or be more holy if you're doing the things that the message says, the health message says, because, holiness and salvation comes through our relationship with Christ. And he's the one who makes it possible for us. The health message, it allows us to live longer, healthier lives, to be a blessing for other people, and to, clean our brains, and enable us to better understand God. So the right focus is important. Again, we must preach the truth, pray the truth, live the truth. The focus is to bring people close to Jesus, as he is the life giver. The other thing, too, when I was referring earlier, when lay people start to want to treat and do things for others, we must remember her counsel, that our focus is to, when we talk about, everyone involved, we must educate people. So she emphasizes the need for health education, health promotion, and to do it pleasantly, not with judgment, not with criticism, not with extremism, as we just saw, but also do it intelligently, which means we have to know if what we're teaching is truly, based on the Bible, spirit prophecy, has the light that it has, and if it has scientific background. Now, this morning we had some conversations and questions about alternative therapies. One of the wrong focuses we're seeing in this message is the focus on alternative therapies, sometimes bringing in things that are not in light with the Bible, the spirit prophecy, or even with good scientific background. And so when we talk about alternative therapies, just to make it clear, we're describing a range of practices that are not generally used as part of modern evidence-based therapies. These include things, as I said this morning, sometimes with a spiritualistic kind of emphasis. This could be things like acupuncture, edible herbs, hallucinogenic compounds, mindfulness, meditation, not in the sense that we understand meditation to be, but transcendent meditation, sometimes Reiki, or even other forms of therapy. So when these alternative therapies are combined with more scientific treatments or evidence-based treatments, then it's known as complementary therapies and or integrated therapies. And this is, I mentioned this morning, the National Institutes of Health in the US has an institute that does research in this area. And actually they're looking at these complementary therapies and looking if there is any evidence to some of the herbs, some of the treatments, etc. Now, some people criticize what they call the Western worldview of evidence-based, but actually this has over the years been not just in the Western countries, but also in many other countries have adopted this. The WHO is global, and so it has brought the importance of evidence to the global field. Now, as I mentioned this morning, there has been a resurgence of what we know to be traditional medicine. And this is true not only in Eastern European Eastern countries, but also in African countries, in India, and many other, in Asia. many other places. And so traditional medicine usually uses a lot of herbs, a lot of other treatments, and in some cases, medicine men or women who prescribe and do, again, many times spiritualistic kinds of things without evidence. And this is gaining a lot of strength because people are trying to get back to their roots. There's this idea of respecting culture and respecting traditional culture, and with that comes traditional medicine being pushed again. And so we will be seeing more and more of this, even by medical practitioners trying to bring some of those traditional treatments back, even though there's not necessarily good evidence. And so we as a church have to focus on what God has taught us and what we know from Spirit of Prophecy to be what we should be doing. And so from the beginning, Ellen White and our pioneers knew that they wanted hospitals, they wanted teaching facilities. In fact, Kellogg, who was the main director of our sanitarium there in Battle Creek, he did experiments. He believed in science. She wanted the doctors and nurses that were teaching and treating people there in these institutions to be trained in these treatments, in this scientific methods, so they knew what they were doing, and the church supported this from the beginning. That's why we had medical schools and we had training. And so as a church, from its founding, we have believed in evidence-based approach of treatment, as well as the lifestyle approach. So we have looked at health as holistic from the beginning, as you know. And in our case today, even through the celebrations program, we teach those lifestyle important health principles that we should embrace. And so as a church, what is our philosophy? We believe in the mind, body, and soul holistic view of a person. We believe that there is a spiritual imperative for us to care for our health because it's the temple of the Holy Spirit and we want God to abide in us. We want to understand God communicating with us more clearly. We also understand that the spiritual perception is very important and is not necessarily out there with the secular either traditional medicine or Western worldview of evidence-based, but we have that very clearly. Now, we focus on preventive health a lot, in particularly comprehensive health ministry, and we believe that lifestyle modification is part of prevention, and many times the answer for helping in the recovery of certain illnesses also. We also believe in acute care medicine and surgery and other treatments, and as we did early on. And so this continues to be a focus where trained health professionals engage in that. And we believe and support that wholeheartedly. We also have a mandate to educate others and to make disciples. And so as part of our work of health comes discipleship. And as it was said earlier, we combine this with the preaching of the gospel. Now, what are we to do? We have to follow this philosophy, and as Dr. Lindley mentioned this morning, we have these 3 criteria for the kinds of things we should engage in, particularly if we're not a health professional working in a clinic or hospital, or even if we are, we use this criteria as well. But if we're not, we have to be even more careful in what we teach in the local churches and what we teach the community. First question is this biblical, or at least in line with the Bible? Because some things, some treatments are not in the Bible, but are they in line, or they are going against a principle that we have in the Bible? We have to ask. Secondly, is there something in the Spirit of Prophecy about this? Any counsel, any adequate counsel? When we say counsel, when we read all her writings, what is the overall, sense of this treatment? What does she say about it? And so is what we're teaching in light with her counsel, or does it go against it? And finally, is it scientifically sound? Is there evidence-based research, peer-reviewed, and based on publications that actually have given robust reasons for us to do this? And so we, as Adventists, again, health ministry, we look for this. And this is exactly what's written in our policy. It says, Adventist healthcare and ministries are to promote only those practices based on the Bible, the Spirit of Prophecy, or evidence-based methods of disease prevention, treatment, and health maintenance. Evidence-based means that there is accepted body of peer-reviewed, statistically significant evidence that raises the probability of effectiveness to a scientifically convincing level. In other words, we're talking not 100% that this therapy is going to work. It's shown, proof 100%, because that does not exist in medicine. Most of the time, we're looking at probability of effectiveness, right? And that means that it's better than placebo, in other words, has some benefit compared beyond the chance or placebo effect. And so these are questions we need to ask when we're looking at alternative medicine, other kinds of treatment. It was mentioned this morning, herbs or other things. We need to look at this evidence as well as the biblical and spirit of prophecy counsel. Now, practices without firm evidence-based and not based on the Bible of spirit of prophecy, including but not limited to, and here's a list of things that we have in our policy: aromatherapy, craniosacral therapy, homeopathy, hypnotherapy, iridology, magnets, methods aligning forces of energy, pendulum diagnostics, untested herbal remedies, reflexology, repetitive colonic irrigation. Repetitive colonic irrigation. I will say that twice because we have had people die from doing this and the church was sued. And it happened more than once. Therapeutic touch. Therapeutic touch. There are people that are doing this as well. Urine therapy. All of these things should be discouraged. This is written in our policy. So, it's important for us to consider. So what do? You have to measure every therapy, everything you do, even in our institutions, against these three, standards. And, there's a decision grid. Does it have, biblical, is it biblically sound or goes against it? Is it in line with spirit of prophecy, goes against it? Is it scientifically sound? Now, even when something, let's say it's not in the Bible, it's not in spirit of prophecy, is it scientifically sound? We have to look. Sometimes we find things that seem to be scientifically sound, but they go against the counsel. Like some years ago, alcohol is good for your heart, so you should drink to prevent, heart problems. Remember that? But again, even in that case, science has grown over the last few years, and other things have been found. Today, they say there's no safe level of alcohol for use. And so, because we stuck to biblically sound, spirit prophecy sound, and said, let's not do it. We know the principle. Now science has come around and has shown to be in line with that. So we need to wisely have common sense and ask God's guidance as we utilize many different ways of treatment. Now, again, as in closing, I would just say, let's ask God to guide us in this. I could go through this decision grid, but I already told you about that. Our goal is to reach the world sharing wholeness, serving all. Our goal is to, as part of our mission, reach as many people as we can with the gospel of God, and use health and healing as a way to get there. There are many ways we can do that, and today we continue to do training in comprehensive health ministry to empower people to use some of these resources. One way that today is being very much part of the plans in comprehensive health ministry around the world is to learn how to relate to people who already know what they should do, but it's difficult to change. That's usually where we find our roadblock. And so, as it was mentioned yesterday, people generally know some of the things that are important for health, but they don't do it. And so we have lately work on lifestyle coaching. Dr. Lennon mentioned that yesterday, training people how to know to walk beside people as they implement what they already know using a coaching approach. So it's something that is lifestyle focused. It's something that's biblically sound. We help individualize plans for each person. It complements the health education that we do in comprehensive health ministry. And it is relational. So it builds opportunities, as Jesus did in his method, to relationships that can lead to discipleship. And so that's one of the ways that we are helping also equip people in that. And my prayer is that all of us will take the call. First, not to be indifferent. And so let them find out what constitutes true health reform and teach its principles both by precept and by quiet, consistent example. God wants us not to be indifferent. He wants us to live more than to speak, to live the message. And he wants us to take a position. And so I end by saying this. Same counsel Ellen White said, I urge that those who are taking neutral position in regard to health reform, that they be converted. That this light may, find space and ascendancy in our heart, so that we can truly make a difference in this area. Obviously, asking God's wisdom so we don't become fanatical and extreme in this. But the promise is sure. When we give of ourselves wholly to God and in our work follow his directions, he makes himself responsible for its accomplishment. And we know that the invitation is there for us. We will not fail if we listen to his wisdom. So may God bless us in this.
Thank you very much, Dr. Katia. I hope we have all listened carefully to this message. I know some of the questions in your head are many. Put those questions aside. We'll have time for question and answer. I'll give now to Pastor Fikaloma. Thank you.
Thank you so much. Good afternoon, everyone. My name is Trevor Fikaloma. I'm the Publishing Director at the SAU. And as Dr. Landless is busy setting up, I just want to take a few minutes to thank you all as leadership here for continuing to support the publishing work, especially the distribution of the Great Controversy. Amen, somebody? We were in Swakopmund last weekend, and with the young people there, we distributed 10,000 copies of the Great Controversy. 7,000 in English and about 3,000 in Afrikaans. Some of those were taken in the satchel, so I'm hoping that they'll be distributed. So I'm praying for your continual support in this regard. Dr. Landless has been presenting already. This is probably his fourth presentation. And Doc, thank you so much for your ministry. I just want to mention he's currently our General Conference Health Ministries Director from 2013. Am I right, Doctor? And so I don't want to go through the information that has been given there. We can read much about it. I'm very much interested now in what he has to present now about blended ministry. So over to you, Doctor, and thank you so much.
Thank you very much.
Sorry, Doctor, and just a moment. In terms of, okay, one last thing. No, let me leave it for that. Okay. Doc, thank you so much.
Thank you. You've done what you need to do. Thank you so much. Thank you. Thank you very much. It's that time on a Sabbath afternoon. So I'm going to invite you to stand and to move a little bit. And we are going to have you just do a little bit of helpful movement so that you don't fall entirely asleep. Okay, let's see if we can get this going. We don't have sound yet, but we will in a moment.
The Elia Fitness. Center neck stretch. Standing nice and tall, place your hands gently behind your head and push your chin towards your chest. Hold that position and feel a good stretch down the back of your neck. Here's a preview of the next exercise. YTWs. Standing shoulder width apart, arms by your side. Raise your arms up above your head to make a Y. In front and then draw them back to make a T. And then in front again and retract those shoulders to make a W. Control your movement throughout. Well done. Time to catch a breath. Air squats. Feet shoulder width apart, arms by your side. Sit back in the seat, and as you stand, drive your heels into the ground, squeezing your glutes at the top. ready for the next exercise. A-skips. Nice and controlled, place your opposite arm to the opposite knee as you drive them forwards,
gonna be fun.
bouncing up and down on the balls of your feet, tucking your heel underneath your hip. Only 5 seconds to go. Well done, great effort. I look forward to seeing you next time.
You know, the best willed things sometimes give us trouble. And my computer has frozen. So that's not fun. Sorry. Can you help me, please? I'm going to talk while we...
Are you restarting it?
I'm not going to restart, no. It's not...
Yeah, I think we have to. If it happens, I have to.
Okay. At a conference like this, and thank you for your patience, I'm sorry as we just restart this computer. It's inevitable that there are going to be areas where we need a lot more of conversation. And this conference has been a venue and a meeting place where conversations can be brought onto the table so that further conversation can take place and further discussion. There are, however, and I think this is very important,
Just enter. Yeah.
it's inevitably going to occur, as I said, that we will need to have those conversations. And I know that the union health director, Dr. Patswe, are you somewhere around? Okay. Is committed to help create those fora. But all those conversations take place within the framework of the health policies of the church we love and serve. When we do whatever ministry we do it within the framework of the working policy book. And the working policy is based on the decisions taken not at a single meeting. They're based on decisions which are made and ratified at general conference sessions. The basic principles and the ratification takes place there. And then for every division, they adopt the policies according to the local venue.
First.
Yeah.
Okay.
So the conversations need to take place. We need to get our definitions of what we talk about, lifestyle centers, talk about our basic approaches. And I had a very, very important conversation just before the session started. Can we get to, thank you so much, Katja. Can we get together and talk about bringing the balance of emphasis? And I'm not going to spend a lot of time on this now, but there's no question that the basic foundation of our church's health message is to live healthfully. And you've heard the comment and also the statement that we should have, or we strive for, wholeness in our brokenness. Because not every disease is going to be cured. Not every ailment is going to be healed. But we can still have wholeness in our brokenness. Fanny Crosby, for example, is an interesting example. And the Apostle Paul himself is one who said that he asked for the healing 3 times, and 3 times he was not answered. And what is the ultimate answer? God said, my grace is sufficient. Hard to accept when you're the one who is in that situation. We hear and we praise God for the healings that take place. We witness that as health professionals, as church members, as treating people. We are thrilled when people are healed. We also need to realize that there are people, and we know it all too well, and there are some of us sitting in this group who know what it's like to have an illness that has not been healed. Does it make the ones who are healed better people? It helps us understand that we are living in a broken world, in a world which is plucking the fruits of the fall, and that will only change when the earth is made new. But in the meantime, we occupy until he comes. And the commentary and the discussion, which I felt was very warm and pleasant, can we bring a balance between the understanding of hospitals, clinics, dispensaries, lifestyle centers, and treating illness, helping people recover, and promoting wellness? That's exactly where we are. Because the whole focus of the health education we do through health ministries, and many others do, the church does not have a monopoly. The organized denomination does not have the monopoly on health ministry. We do have, whenever health ministry is done in the name of the Adventist, done in the name of the Seventh-day Adventist Church, that it falls within the parameters of the policy. Is there room for supporting ministry? Of course there is. but it was planned by the South African Union. And the topics were planned and chosen by the South African Union and the entities dealing with health ministries. I do know from much of the correspondence I received during the pandemic of the thoughts and the feelings and the angst and the anger that resulted from the whole issue of COVID, the vaccines, etc. And the etc. is a huge etc. And the things which continue to trouble me are, number one, how our church, with the understanding it has of eschatology, prophecy, health, can then confuse all the issues that were confused in a public health crisis, because that's what we were in. And I'm going to reverse back to 2015, when the church voted a statement on immunization. And in that statement it said, the church is not the conscience of the individual. Do you agree with that? Yes. So the church is not the conscience. The church encourages, but it is the choice of the individual. Go and read the statement. It's there. I'm still, and we are, Elder Wilson gets them, and he has the good fortune of passing them on to me. And I will soon have the good fortune of passing them on to Dr. Zeno. That the church must retract its statement. Why? The reasons longevity has increased over the last 100+ years has been because of three basic factors. Number one, clean water. Number two, sanitation. And number three, immunization. Those three interventions. Now, you're not listening to a public health specialist. I'm a cardiologist with internal medicine background, family medicine specialty in cardiology and nuclear cardiology. But I incontrovertibly state, without any question, that public health measures make the difference much more than the nuances of what we eat. Of course, diet is important. Before people say, and you run away with an idea saying the Director of Health Ministries of the General Conference says what we eat doesn't matter. I didn't say that. What I will say again is that our health message is not one of diet alone, nor is it one of what you drink alone. It's not water alone. It's not sleep alone. But it's a holistic message to every part of our being. If anything has been emphasized from the beginning of this conference to now, it's that we are holistic beings made in the image of God. And he has given instructions on how we can look after this amazing, amazing body he's given us. This amazing body which is so patient with us because we abuse it, we maltreat it, we malfeed it. And you know what? It doesn't say, I'm sick of you until the day we die. And so all those things that have arisen and caused tremendous division within our church. Division where people fight with each other. It used to be over whether you're a total vegetarian or an ovo-lacto vegetarian or a pesco vegetarian, or if you're a carnivore. And when we teach our pastors in postgraduates in Africa, and it's been one of the greatest joys, because Africa, if Elder Conway says he loves the South African Union, I was born in the South African Union. And I worked for the Southern Union for my career, my starting as a physician in mission work. We argue issues, and we train our pastors, and they would say, "Doc, we love this." They would be studying what is in her trolley as she takes it out. Really? Really? The pantry patrol comes along and says, "Well, what are you eating?" We have to be careful that a lot of I remember some of the finest saints that we had in our church when I was growing up made health reform an iron bedstead. And Dr. Reinert then quoted where she says we can't blame people when they get what? Disgusted. There's a quotation, if I get time to share it, I'll share with you. She writes so beautifully, and I believe in the spirit of prophecy with all my heart. But she writes beautifully, she says, if people see that we are intelligent about health, they may believe that we are intelligent about our doctrines. And then we present this picture to the world and to the church and to our children where we can't agree on anything. If you're not a total vegetarian, or if you eat meat, you are lost. You know, she writes that as we get closer to the end of time, the eating of meat will fall away. She doesn't say the eating of meat will be beaten out of the church. I'm being deadly serious. If you look at the trees after autumn, and I just love the time of year I'm seeing here. I'm seeing the trees shedding their leaves because I love it. Why? Because there are going to be new leaves coming soon. And towards the middle and the end of winter, there are still, and I remember as a little boy growing up in this country, because it was my job to clear the leaves in the garden, that there were still leaves falling when I thought they should have been gone long ago. But what takes those last leaves off the tree? When new sap comes in. And the new sap comes in and grows and pushes off the old leaves. But we want to take the leaves, the trees, whether they've been in the church a year, a month, or 10 years, and we want to shake the leaves off them. That's not his plan. I had no insight as to what Elder Comwe was going to talk about today. I thank God for what he said. And I'm going to be very, very vulnerable and direct with you. It's so much better when the president of the division shoots my bullets for me. Because when I say it, oh, he's in bed with the drug companies. He's a physician. What more do you expect? Dr. Okomwe is not a medical doctor. Let he who has ears hear. And my plea to you, what he said as well, and I'm going to put this on the table as well, and this is not on the program, and please forgive me if you have to. This union has been through enough heartache, pain, and issues. When the number of 198,000 was mentioned, I know because I was born here and I grew up here. I'm aware, I cannot say I know, because I grew up with a white skin. But I'm aware of the pain this country's been through and continues to go through. How long are we going to remain divided? We can't afford it. We can't afford it. And there's been suffering. There has not been apology. There hasn't been our getting to the point where we need to be. And there's a work to be done. Who is going to do it? If not you and me. We can't afford to be divided additionally, not only by our history, because of the pain of inequality and the pain of suffering, and now be divided on whether someone has a bit of milk or a bit of cheese. Now I know you'll take me and point me directly to where Ellen White talks about cheese shouldn't appear on our table, and then I will also take you to a point where Willie White tells us that she was talking about the stuff that walks off the table. You kind of have to hold it down, otherwise it runs away from you. And again, the Health Ministry's department in our policies and in our teaching talks about the use of dairy as a condiment. You know what a condiment is? You use small amounts. Why? Because people need essential nutrients, like vitamin B12. Or do we go roughshod into an area where people are not, Professor McQuena, you used the term health literate, and we tell them, all of you, throw all the meat out, throw all the dairy products out, no animal products, and we don't tell them about vitamin B12. Ellen White addressed an individual who had vitamin, well, we look at it now, Dr. Kress had become a total vegetarian. And in those days, they didn't know the word cyanocobalamin, vitamin B12. Nobody knew it. But he was sick and he was dying. And in fact, they had already prepared the coffin for Dr. Kress. This is the one who was alive in the time of Ellen White. And she wrote to him. And she wrote to him in the following, and she said, I'm advising you to take every day a glass of grape juice. She didn't say that, I'm saying unfermented grape juice. A glass of grape juice with an egg in it. Mix it up and take it. And he did that. They didn't need to use the coffin. because he resurrected. He got better. And why do you think he got better? Because he was given the essential nutrient that was lacking. We face this issue a number of times, and I'm not giving you anecdotal stuff here. We've seen this in patients, we've done research. In fact, I'm not going to mention the name of the institution, but in the early 2000s, we invited supporting ministries to the General Conference, Health Advisory, and we challenged them to check the vitamin B12 levels on their patients and on their people they were seeing and following up. And the majority of them were B12 deficient. If you go and look at the pathophysiology of B12 deficiency, which really ultimately damages the nerves, vitamin B12 is essential for the integrity of our nerve function and structure. And when it's lacking, you develop neurological changes. But interestingly, if you go and look deep into the literature, you'll find that one of the initial changes before there are any clinical signs of vitamin B12 deficiency is changes in the electroencephalogram. That's the electrocardiogram of your brain. I wonder then why there are sometimes so many angry vegetarians. And as we get older, whether you're eating meat 3 times a day or whether you never eat it in your life, we don't absorb vitamin B12 as we did when we were younger. So if you add to that, you go on to a total vegetarian diet without the essential vitamins, and you're not absorbing it anyway, you'll end up in trouble. And then people come along and tell you, you know how you can resolve that? Because there are bacteria that help us to absorb it. Don't brush your teeth until you have been... Have you heard the story? Some of you have. Because some of you may think that I am sucking it all out of my thumb. I don't have a thumb as big as that. That will help you to provide the vitamin B12 that you need. Come on, saints of the Most High, what are we thinking about? So what is talked about? Educate kindly, gently, appropriately, and allow God's Spirit to do its work. I was going to talk to you about the blended ministry. We'll leave that for another day. But I'll tell you what the blended, because my half an hour is gone. It's just gone off now. The blended ministry, in essence, is the following. The blended ministry can be aligned to a smoothie. How many of you have enjoyed a smoothie? Do you know what a smoothie is? Well, I better define it before somebody thinks I'm talking terrible things. It's a liquidized form of your choice of vegetables or fruit, and it can be very healthy and be very tasty. And what I will add to you with my little cynical own personal view is that you deprive yourself of the benefit of the fiber as you would normally get it. But if you like a smoothie, that's what you want. And then some people go and adulterate it with all sorts of other admixtures like ice cream. But don't do that. But when you take a smoothie and you make one, whether it be of cucumbers and celery and spinach and so on, it usually turns out to be green. But some people are very adventuresome and they'll put beetroot and they'll put carrots as well. And when you look at the blended result, do you see carrots? Do you see beet? Do you see celery sticks? What do you see? You see a blend. A blend. And that's what the blended ministry is. The blended ministry is health work being done in a way that as people receive the blessing of our ministry, of our caring, whether it's in health education, whether it's in treatment, whether it's in nursing, whether it's in lifestyle changes, that what they are seeing the love and compassion of Jesus Christ mixed up in that intervention that is touching the life, and God's Spirit will encourage them to know where to go from there. So the blended ministry is health professionals especially, and she writes specifically to us. And she says, you have a higher responsibility because you have a higher understanding, a better understanding, not higher, better understanding because of how we trained. And people become vulnerable to us, and they come to us for advice. They come to us for treatment. And not only do they come and they ask for treatment and tell us what their problems are, they then get undressed in front of us. And then the story gets more interesting. After they've come in, made themselves vulnerable, talked to us, told us all the things they need to, gotten undressed, are examined, we then send them an account and they pay it. Those of you who are thinking will get what I'm saying. What a privileged position. And our role as people make them vulnerable, themselves vulnerable to us, to be that smoothie of addressing their physical, mental, spiritual, and relational well-being. That's the task Christ has given us. And if you look at the healings that he did, physical, mental, often he said, neither do I condemn you. Go and sin no more. Your sins are forgiven you. Spiritual, blended, all in one. And interestingly, the Pharisees couldn't see it because they were looking for the evidence of the celery, of the beet, of the carrot, but the whole blend was the healing. The other thing as I close, it's been my privilege to spend my entire career in the blended ministry. Encouraged, and I share this with you as fellow health professionals, by her writing in medical ministry, where she addresses the issue, I'm going to stop right now, where he addresses I'm going to stop just now then. She said, she writes to a young man and says, I'm writing to you, I'm sharing with you what I've been impressed to share with you through the night. She says, I see you are worried about what you should do. You are perplexed. He writes, he had already told her that she was concerned. He was concerned about whether he should work for the church or work for another group of people. She said, you are not your own. You are bought with a price. All you have, all you are, everything of you belongs to him. It's to be used in his cause. Do not join hands. Do not be unequally yoked. When I saw that, it was at a time of making decisions, and many of you are making decisions as to what you're going to be doing in your life into the future, how you're going to serve, what you're going to do. And it's not the same for everyone. The Lord uses people. We've been blessed by the most expert health professionals who we've had serve us in this meeting. Thank you to each of you. Well thought of professors, leaders in this country. Are they serving in a blended ministry? You better believe it, because I know what they do after hours and during their hours. Amazing things. The important thing to remember is that we are his and we are to serve him in whatsoever we do. whether we eat, whether we drink, or whatever we do all to the glory of God. My prayer is, we've touched on things. I had no intention when I got up to speak, I was not going to say to you what I've shared with you now. But I feel that it's important because this is probably the last chance I'll have to do it. Do not get caught up in petty polemic. We've got a job to do, and we need to do it soon. Gracious Father, you love each one of us and the South African Union and your church. This is your bride. You died for us. I plead your blood upon not only this group, but upon this union, asking that you will lead in every single decision, every plan, every conversation, and let it begin at this meeting. Bring us into not a cookie-cutter unity, but into a true unity in Christ Jesus, where each one will consider the other better than themselves. Help me to do that. Save us from the arrogance of our personal pride and opinion. Substitute it with the humility of your cleansing Spirit. And Lord, may this be a day in each of our lives where we again renew our commitment to you, to follow, to serve, as you wish us to. In Jesus' name, amen.
What does the church say to Dr. Landless? What a timely message. Are we supporting or we are dividing? I think it's a very relevant question. Dr. Patswa, if you can come and guide us as to next. I think we've got one more program, but and I'm sure many people have got questions, so I'm sure he will let us know when we can have a Q&A before we break for the day. Thank you so much.